But we begin tonight talking about your health. Joining us is Dr. Joshua Forman, a gastroenterologist at the University of Maryland's St. Joseph Medical Center. Doctor, thank you so much for joining us. Let me start by apologizing for my voice. I don't know if it was either Sunday Night Football or I'm getting over something, but we're here to talk about GI health and the holidays. What are some of the things that get in the way of eating well during this holiday period?
Well, thanks, Jeff. Thank you so much for having me. It's such a great topic. The holidays are such a fun time, but we have all these things thrown at us, travel and parties and all this different food thrown in our face, sometimes alcohol thrown in our face. And if we don't make good decisions, it has a dramatic impact on our gut health. And just so important to keep in mind that being mindful with keeping your gut healthy is going to make the holidays a whole lot more comfortable for you as you go through this fun time of year.
So you wouldn't sign off on my plan to have nothing but pizza, wings, chips, maybe some beer while watching a bunch of bowl games?
Although that sounds like an unbelievable time, and I might join you for part of that. Definitely not a way to keep your gut healthy, but there are several things to keep in mind that might make the holidays a lot more enjoyable from a gut standpoint. And happy to go through some of my thoughts on that with you if you'd like.
Yeah, please do.
So I think a couple of things to keep in mind is it's in terms of that tailgate buffet you described. I think it's important to pregame as you're thinking about joining holiday parties and family dinners. It's always good to get something healthy and filling, maybe something that has some fiber in it, and that's always something to keep in mind as you're planning to go out and as you go to parties and family dinners. Is maybe beforehand some whole grain cereal or oatmeal just to fill up the old gut, and then once you're there, you always want to think about things that are a little bit healthier than the pizza and the wings. Just looking at things like veggies and dip, whole grain crackers, popcorn, fruits. You can do some chocolate covered strawberries. The chocolate, if you do it in moderation, is not going to hurt you too much. Lots of antioxidants and minerals, things that are good for you.
How about the role of water?
Yeah, hydration is so key, Jeff. I'm glad you brought that up. You always want to make sure you're keeping yourself hydrated. That's important both when you're eating and particularly if you decide to have an alcoholic beverage. Just the more you hydrate, the less likely you are to feel bloated and full. And it's also going to stop you from wanting to keep putting things in there. You'll feel more full and more satiated.
One of the things that happens in the holiday season is we're off our routine. How much is our digestive system a creature of habit?
It's such a creature of habit. Just anything we do that throws us off kilter in terms of both our routine from just a life standpoint. We're running around like crazy this time of year. So many different places. We're all these foods that we might not eat on a regular basis put in front of us. But taking us out of that cycle is definitely going to affect both the way we feel, and it can even affect our gut microbiome, Jeff, which is the bacteria and other organisms that reside inside our GI tract that play a huge role in how we feel. And if you throw that off, it definitely can result in some symptoms, just upset stomach, diarrhea, constipation. So just important to try and stick to routine as best you can.
The concept of the microbiome is sort of gross. Like we're all carrying around a lot of these bacteria. What's known about it?
So we're just getting to know the tip of the iceberg, really. It's unbelievable. We've learned that the gut microbiome, these organisms that make up our gut, are an entire organ system and may actually be one of the most complicated organ systems in the body. And if you just happen to have the wrong balance of bacteria, it just influences the way we feel. So stay tuned. There's going to be a lot more that we learn about that in the years to come. And we'll see us start to begin to manipulate that both with diet and with therapies to improve our health and influence the way we feel.
One thing I read, and I can't remember where, was the idea that our gut, maybe I'm overstating it, has one of the biggest collections of nerve cells in the body outside of the brain and the spinal cord. There's like a lot of signaling going on.
Yeah, it's so true. I love to tell people that exact thing, that there are as many or more nerves in the GI tract, but it just goes to tell you it's an incredibly complex organism. Sometimes depending on who I'm meeting, it's people look at me when I say I'm a GI doctor and just say, oh, that's disgusting. But it's an important organ system. It just highlights how important the gut is for how healthy we are and how we feel.
Let's take a call from Baltimore City. This is James. James, thanks for the call. Go ahead.
Thanks for having me. I had a question about what your guest thought about kombucha, if I'm pronouncing that right, and also taking medication without adequate water. What would that do? Thank you.
Two good questions. Thank you.
Awesome. It's good question, James. So thanks for the call. So two different questions. So the first one about kombucha. So kombucha and similar items that kind of help diversify the gut microbiome by providing kind of healthy fuel for the gut, or by changing the microbiome in a positive way. I support is a healthy thing in moderation. And then in terms of taking medication, super important to make sure you hydrate with medications, particularly certain things like nonsteroidals, like ibuprofen, Excedrin, Aleve. If you don't take enough water or hydration with those, that can cause problems. And certain antibiotics, doxycycline, but all medications, you need to stay hydrated. You want to make sure it gets down to where it's supposed to go. And just the importance of hydration overall can't be overstated.
Talk about alcohol a little bit. Big part of holiday celebrations.
Yeah, for sure. So alcohol is great, to have a drink or two when you go to a holiday party or a celebration or family event or dinner. But you got to be careful with alcohol. Just drinking too much alcohol is going to put you at risk of having reflux, so acid in the stomach that can come up into the esophagus and cause heartburn or a feeling of indigestion that can lead to complications down the road. And it's going to contribute to you feeling poorly if you drink too much alcohol. I think furthermore, it's super important to not necessarily a gut related item, but to moderate how much you're drinking. It's easy to see stuff there, not always keep track of how much you're drinking. It's just so important to never get in the car if you've had more than a sip.
Absolutely. Now, for people who do, despite all the good advice, despite all the good intentions, wind up overindulging a little bit, has the advice for dealing with heartburn, that sort of thing, changed at all over the years?
Well, I don't know so much that it's changed, Jeff. I think that there's just there's so many tools available. There's so many arrows in the quiver, so to speak. There's stuff you can take that's over the counter. There are what are called H2 receptor blockers. Folks may have heard of famotidine, which is Pepcid, or cimetidine, which is Tagamet. Those can be extremely helpful. Both of you're going to eat a little bit more than you normally do, and you might feel lousy afterwards. That's something that for most people, certainly consult with your personal physician, but something to do even beforehand, or can do if you have the symptoms. Things like Prilosec over the counter, and those medications, the proton pump inhibitors, can be used also. And then there's simple things that people don't always think of that are tried and true and been around forever, simple and safe. Ginger and ginger tea can be very helpful for soothing the gut, and so can peppermint tea can actually be helpful if you feel bloated or uncomfortable. Chamomile tea is another thing. So lots of things available.
And I just have time for one sentence on this, but can't talk to a general gastroenterologist without reminding people about colon cancer screening. Who should get checked?
So great question. Thanks for bringing that up. But the screening age currently is 45 for average risk individuals, folks who don't have a family history of colon cancer or polyps or a condition that predisposes them to cancer. If there's a family history, it's usually age 40 or 10 years before the age of diagnosis. But certainly important.
We will leave it there. Dr.
Joshua
Forman, University of Maryland, St. Joseph Medical Center.